Welcome to the Health Boost with Sneha Mordani and we have some big news coming in this morning, and this is with regard to the Covid-19. Now here's what the latest is. According to the World Health Organization, classifying JN1 COVID strain as a variant of interest, but said it did not pose much threat to public health. Now this variant was previously classified, remember, as a variant of interest as a part of its parent lineage. The agency has said that the current vaccines will continue to protect against severe diseases and deaths. But remember, the WHO had also earlier said that the virus is constantly changing, evolving, urging the member states to continue strong surveillance and sequence sharing. Kerala, Karnataka, Maharashtra upping their surveillance in light of increasing cases and deaths. So I want to immediately bring in Sneha Mordani, who's been tracking Sneha in the past few days. And I don't want to alarm the viewers. I don't want to start 2024 like we started 2020. But what is this new variant?
Yes.
Is it as deadly as what we saw in 2020, 2021? And tell us more first about the cases.
So essentially, yes, there's been a surge in cases.
Wow.
And Kerala, in fact, is topping the states with the maximum number of cases. Like the previous time, definitely better surveillance in this state, better monitoring. You have to give it to the Kerala government as far as the monitoring is concerned. Deaths in Kerala, 5, 1 in Karnataka, 1 in Uttar Pradesh. And like you said at the outset, you don't want to sound alarmist. But the fact is that COVID hasn't gone away, and that's the reason why, Pooja, even though it continues to be a pandemic, it's not a global health emergency. JN.1 is the baby essentially of Pirola, and Pirola has emerged from Omicron, which is a 5th variant of concern, which, if you remember, led to the 3rd wave in India. Has been dominant since November 2021 and when it first really surfaced. So it's from the family of that particular variant, which is the variant of concern. The World Health Organization has said because of the high transmissibility of JN.1, it's an independent variant of interest. And they're not linking JN.1 to its father because it seems that the son has become stronger and has the potential to infect more than his father, which is BA.2.86.
And quickly what we can do?
Definitely travel precautions, not just yet. Like if you ask me, should I mask up right now in the newsroom? I would say no. But if you ask me that if I'm not feeling well, if one day you don't feel well, should I come to work? I would say don't come to work. That is what the government is saying. The government has not said anything about restrictions, about precautions. The government also has not spoken about the fact whether the vaccines right now should be in fact taken, if those who have not taken the 3rd dose or the booster dose. That is not something that the government has said. What the government is saying that report illnesses. RT-PCR testing, only 1 in 10 people are doing it right now as per a survey by the local circles.
Which means we should not become callous at all.
And when you're traveling, Pooja, if you're on a flight, which you might be because you're also going on a chutti, you have to mask up is what I was saying, because this is what experts essentially are saying.
Best to take all precautions because as Sneha is correctly pointing out, the numbers are increasing, there are variants, it's mutating, all of this. Remember, take care of yourself. Let's usher into 2024 with us being responsible citizens before we start to charge and everything else. Thank you so much. Sneha Mordani, Health Boost, every morning 9:30 a.m. We'll continue to bring you issues that directly concern health of you and mine. Thank you so much for tuning in to India Today Television this morning. Stay tuned.